Hello everyone, I am Dr. Kavya, pediatric anesthesiologist. In this video, I will be discussing about the technique of mask ventilation in pediatrics. Effective oxygenation through appropriately performed mask ventilation is the first life-saving intervention and the cornerstone of pediatric airway management. So let's learn the science and art of mask ventilation. Step 1 is to choose an appropriate size face mask. Choice of the mask is based on child's age and facial dimensions. Place tip of the mask on the glabella and drop it down on the chin so that it's neither too big to cause compression of the eyes nor too small to block the nostrils. Step 2. How to position the child during mask ventilation. Infants are different because of anatomical variations. The disproportionately large occiput results in passive neck flexion in neutral position and obstructs the airway. Therefore, in infants, placing a shoulder roll and a small headrest opens the anterior neck space, brings glabella to chin and external auditory meatus to sternal notch horizontally aligned to facilitate mask ventilation. In an older child, keeping a small headrest would bring the plane horizontally aligned and open the airway. Never ventilate with neck in flexion during mask ventilation. Appropriate neck extension facilitates mask ventilation. Step 3. One hand technique of mask ventilation. Tight seal is achieved with the C and the E technique. Thumb and index finger of one hand forms a C over the mask and used to control the seal of the face mask, while other three fingers form E under the jaw to lift it forwards. Jaw thrust is achieved by lifting the angle of the mandible forwards, resulting in anterior displacement of the head of the mandible and maintaining airway patency by opening the mouth. If jaw thrust is inappropriate, it can close the mouth and cause airway obstruction. Step 4. Two-hand technique achieves better ventilation than the one-hand mask ventilation technique. Here, the operator uses both the hands to achieve seal while maintaining airway patency by jaw thrust, and an assistant provides the ventilation. Ensure that soft tissue is not compressed during ventilation and fingers are only on the bony margins of the mandible so as to avoid obstructing the airway. Step 5. Gentle mask ventilation. Ensure that ventilation is gentle, maintaining the insufflation pressure less than 10 to 15 centimeters of water and tidal volume less than 6 ml per kg, so as to avoid gastric distension, which decreases FRC in children and worsens ventilation. Difficult mask ventilation. Review of cases in pediatric difficult intubation registry has shown syndromes like Pierre-Robin's, golden hair, Tricher's colon to be frequently associated with difficult mask ventilation. Certain cases of difficult mask ventilation can be handled with use of airway adjuncts. Appropriate size oropharyngeal airway is measured from angle of the lip to the angle of the mandible, while that of the nasopharyngeal airway is measured from the lateral edge of the nostril to the tragus of the ear. Rescue use of supraglottic airway devices in children with difficult mask ventilation should be strongly considered. Follow the pediatric difficult mask ventilation algorithm proposed by Association of Paediatric Anesthetists and Difficult Airway Society, and remember to rule out causes like inadequate muscle relaxation, laryngospasm, bronchospasm, and equipment malfunction in any case of difficult mask ventilation. Induction techniques also significantly influence mask ventilation in pediatrics. Anxiety being one of the cause wherein difficult mask ventilation is functional, resulting from breath holding and laryngospasm. Here's where smooth induction techniques play a role. In infants less than 6 months, the little finger of your hand is placed in their mouth while you hold face mask near their face. They generally stop crying and eagerly suckle on your finger and go to sleep calmly. Preschool children can go to sleep watching their favorite cartoon videos on their phone. School-going kids are promised goodies if they perform the task of blowing the balloon well and put to sleep. Therefore, mask ventilation in pediatrics is science learned and art mastered. Success lies in staying calm.